Next on Moms Every Day, we'll explore another option when it comes to surgical weight loss. Stay tuned. Today on Moms Every Day, we are at Cernero Surgery in Denison talking with Dr. Cernero about the gastric sleeve. Now, you and I have talked about the lap band process before. What is the difference between the two?
Well, the lap band, as we talked about before, is a device that we place around the upper part of the stomach to cause an obstruction. In a sleeve gastrectomy, we're actually removing 80 to 90% of the stomach permanently.
Oh, wow. So you're just making it a lot smaller.
Exactly. We're taking a stapling device and we're removing this bottom part of the stomach, so it creates a smaller pouch so you can't eat as much.
That was going to be my next question. What does this do as far as a person's eating habits? Because obviously they're going to have to change.
They still have to choose the right foods, but they're going to eat smaller quantities. And there's also a hormone that's produced in this part of the stomach that tells the brain it's time to eat. By reducing this part of the stomach, that hunger hormone goes way down.
All right, so then it's up to the person's best judgment.
That's right. They still have to choose the right food.
Now, since they are eating smaller amounts, are they eating more often throughout the day?
Exactly. They're eating more like 3 or 4 to 5 times a day. That gets them to eat less and less calories, which equals less weight.
So how does a gastric sleeve patient learn to eat properly?
Well, we send them to a dietary consultation before they have the surgery. And we also offer that to them after the surgery so they can continue to learn how to eat with a new stomach.
And do they have to avoid certain types of foods, or, more protein, less carb, or less fats? Are there any restrictions?
We certainly try to get them to eat more proteins, up into like 90 to 100 grams of protein a day. So it is something different than they're used to.
Is this process covered by insurance?
It is covered by insurance, but there is a process, and sometimes it takes 1 to 6 months to get through the insurance process.
Okay, so if this is something that you're considering and you're thinking, well, December would be a good time, you might want to get started now.
If you wait till December, you're not going to get approved under insurance at that time.
Really? It takes that long?
It takes up to 6 months.
Okay. What else do candidates need to know? What makes them right for this type of procedure versus the lap band?
Well, when they come to see me in the office, we sit down and we talk about all their options, and I will tell them what I think is the best thing for them, and then we'll make a decision together.
All right. How overweight is a person before one of these options is right for them?
Roughly 70 to 100 pounds and more. Patients, those are the patients who qualify for weight loss surgery.
All right. Dr. Cernero, thank you for the information.
Thank you.
Appreciate it. I'm Ellen Sacco. Be sure to check out our website, momseveryday.com/Texoma.